So now we'll be talking about diagnosing rheumatoid arthritis or RA. Now we must know this rheumatoid arthritis is extremely common almost everywhere, and diagnosing it many of the times can be challenging for many reasons. So the most simplest definition of rheumatoid arthritis is it is almost always symmetrical, it is inflammatory, it is polyarthritis, so that it involves number of joints, and it mainly involves small joints of hands, feet. So involvement of small joints of hand is one of the most important criteria for rheumatoid arthritis. And if it is not well controlled, it will simply lead to destruction of all the joints over a period of time, and it will present with a deformity, what we call it as a burnt out rheumatoid arthritis. So deformity is extremely common if it is not well diagnosed in time or treated. So as per the recent 2020 American College of Rheumatology annular classification, we see total 4 points. The first point is the involvement of joint. So what we do is we simply give numbers or points as per the criteria. So if there is only one single large joint, if it is involved, we give score of 0. If there are 2 to 10 large joint involved, then we give a score of only 1. Now, as I told, the rheumatoid arthritis is one of the disease of small joints mainly. So if there is involvement of 1 to 3 small joints, the score that we give is 3, which is significant. And if there are more than 10 joints involved, at least one of which has to be a small joint, then what the score we give is 5. And most of the time in rheumatoid arthritis, in bilateral hands, there will be number of small joints involved, which very easily cross to more than 10 small joints. The proximal interphalangeal joint, the distal interphalangeal joint, the metacarpal phalangeal joint, these are very commonly involved joints. The wrist joint is also very commonly involved. So very commonly, this total number of joints will be more than 10 joints. So we count each and every small joint into this, and that is how we give a score of 5. So this is the one of the most important thing to remember. Second, we see presence or absence of a rheumatoid factor and anti-CCP antibody. So if the rheumatoid factor and anti-CCP antibody, if they are negative, we give score of 0. If they are positive but in very less titers, we give score of 2, and if they are present in a very high titer, we give score of 3. This is one of the very important criteria. The third thing what we see is presence of acute phase reactants, that is CRP and ESR. We must know CRP has a very short half-life, so it increases and it decreases very fast compared to ESR, whereas ESR is kind of a phase reactant which lasts longer than ESR, CRP. So if CRP, that is C-reactive protein, and erythrocyte sedimentation rate, if it is normal, we give score of 0, and if they're high, we give score of 1. And the last thing is the duration. If the duration of all the symptom, all this joint pain, if it is less than 6 weeks, we give a score of 0. And if the duration of the joint pain is more than or equal to 6 weeks, we give score of 1. So if the total score is more than 6 or 6, we call it as the patient definitely has rheumatoid arthritis. For example, if someone has right and left hand joint involvement, around 3 to 4 joints on left and 3 to 4 joints on right, then automatically it will be around 3 to 5 joint. Most of the time patient will have this anti-CCP antibody positive or rheumatoid factor positive. Even if it is positive in small titers, then also the score will be 2. If CRP and ESR, most of the time it is always high, the score will automatically become 1. So 2 plus 1, 3. Here around 3 to 4, it is already 6. You don't have to go here as well. So this is very interesting and very nice criteria to remember. The other the most important points about rheumatoid arthritis is, as this is an inflammatory joint, patients very commonly have morning sickness, which very commonly lasts for more than 1 hour. So most of the time, the patient wake up and they have to do physical activity, they have to do physical exercises, then only they feel better. As they keep on doing exercise or as the day pass, their pain markedly improve. So it improves in summer and it the joint pain improves with exercise, and this pain is significantly worse in winter because in winter the temperature will be very low, as this is an inflammatory disease. With cold the pain will worsen, with heat the pain will get much better. The other point is the osteoarthritis. We must know that osteoarthritis is a non-inflammatory disease, and the osteoarthritis mainly involves the weight-bearing joints like knee joints, ankle joints, and very commonly, even with this slight exercise, the pain will markedly worsen. So, which is exactly opposite to rheumatoid arthritis, which mainly involves the small joints, and it markedly improves with the exercise. So this is what is the criteria for rheumatoid arthritis. Thank you.